Hi, I'm Robert Bunnell. I'm a PT and instructor here at Great Lakes Seminars, and I'm here to show you a brief technique that we cover in my course, which is the Advanced Manual Therapy Concepts for the Spine. This class covers the cervical, thoracic, and the lumbar spine complex, and does dabble a bit into the sacrum. In this video, we're going to show you how to perform a cervicothoracic mobilization and manipulation. This technique can be performed by PTs, PTAs, ATs, chiros, pretty much everybody who is legally allowed to perform a mobilization. Whether or not we perform a manipulation is usually dependent on state licensure and restrictions in that regard. We'll show up setup for the mobilization, and I will also show the force production and how we perform the manip during this demonstration. So first things first, big thing is we need to screen our patient, make sure they're safe to do this. There's a bunch of screening things we do prior to this, but this is assuming that our patient is safe to perform a CT manip, that they don't have any current issues that would preclude from doing mobilizations or manipulations in her cervical spine. She has told me that she does not have them, so we will not be concerned with that. In this setup, I'm going to be treating her CT junction into a left rotation. So I'm going to be on her left side and perform a force with my treating hand, which will be right here, where I will use the force production through the web space of my index finger on my right hand, through her CT junction, which is approximately at C6 through T1, right here in kind of the nape of her neck. Okay. In this position, I'm going to set her up so that way her right arm is placed kind of off the table in a relaxed position. We can also have that at her side. It's usually patient dependent. What needs to occur is we have to have our left hand in this circumstance put in this flex position. And what this does is it locks out the thoracic spine and the left ST complex, the shoulder complex. So that way, as I perform this technique, we're not rotating her off the table. Now, when we get started, we want to make sure that, one, our patient feels safe and secure in this position. If there's any pain, discomfort, the patient doesn't like this position to begin with, we're going to hold off on the mobilization. We're definitely going to hold off on the manipulation. Now, does this bother you right now?
No.
No. Patient feels okay in this position, and what we're going to do is we're going to set up for our mode. On her left side, I have my left leg forward, on the basically at eye level with the patient, and my force production with my treating hand is going to go down towards my toe on the floor. It's going to look like this. My offhand, my non-treating hand, is going to be placed on the side of her head, right here, on kind of the occiput, or not the occiput, the parietal lobe. And what we're going to do is we're going to perform a counterforce force production. So my treating hand is going to go down towards my shoe. My non-treating hand is going to go here, stabilizing the head and neck and performing a slight amount of counterforce. The mobilization will look like such. Force production is linear through my forearm towards my toe or my shoe. Off body, the force looks like this. Now, if the patient feels like a manip is okay, if we feel like a manip would benefit from the patient, we'd ask for consent to begin with. If we are in a restrictive state where your license does not allow you to do this, we will not do that. We'll stop at the mobilization. Okay. Do you feel comfortable with me performing the manip?
Sure.
Okay. So in this position, I'm going to come into end range and then quick mobilization force. So a manipulation is a high velocity, low amplitude thrust. Our objective is to go short and sweet and put force through that barrier or the restriction. So hopefully this technique benefits you in your practice as a quick refresher of a skill that you've already learned or something new that you haven't tried yet. If you're eager to learn more about these techniques, I'd encourage you to take our course here at Great Lakes Seminars and learn more about how you can perform mobilizations, manipulations through the CT junction to assist your patients with left and perhaps right rotation. Thank you.